Good evening and welcome to the coronavirus meeting for, April 2nd. My name is Brian Wheeler from Public Health. We have a panel tonight of Dan Holler from the town. We have Dr. Craig Barrows from the hospital, our health officer, Dr. Boo, and Frank Frevold, our Unified Command Leader. So thank you all for joining us today. I first want to address questions and answer session. So you are aware, we will answer questions at the end. If you're calling in and you'd like to raise your hand for a question, you'd have to dial *9. For those of you who are using the Zoom app, you can certainly use the raise your hand feature or just write in the text box. And like I said, at the end, we will address all questions. So first, I'd like to have Cassandra Montez from our Public Information Team address the Latino community.
Buenas tardes a todos. Mi nombre es Cassandra Montes. Soy parte del equipo de Centro de Operaciones de Emergencia con el Condado de Mono. La reunión de esta noche solo será en inglés. La razón es que mi equipo y yo estamos trabajando para entregar la información a ustedes, mis latinos, de una manera auténtica y culturalmente apropiada. Mis latinos, por favor, tranquilos. Pronto podremos brindarle un servicio de noticias en vivo donde nuestro objetivo sea responder cualquier pregunta que tengan sobre el COVID-19, coronavirus y cosas relacionadas. Mientras tanto, síganos en nuestras páginas sociales de Facebook para más información. Gracias.
Thank you, Cassandra. So our first panelist to speak tonight will be Frank Frevold, our Unified Commander.
Good evening, and thank you for joining us again. Tonight, I just wanted to touch on 4 items that are our current focus at this stage in the response. Really, the first is the EOC is going to continue providing support in a coordinated response countywide from north to south. Next item is continuing our buildup of logistical support to handle a surge in patients if that occurs. The third is to finalize our operational protocols. We're providing some service delivery in unusual ways to meet the anticipated surge. And then finally, we want to maximize personal and social distancing as we have up to this point. It's the single best way for us to be able to care for the needs of our community if they get sick.
Thank you, Chief. Our next panelist will be our Public Health Officer, Dr. Thomas Boo.
Good evening, everyone. Tom Boo, Public Health Officer, Mono County. I'm not going to say very much. Kind of want to leave more time for questions and answers tonight, but did just want to acknowledge how hard social distancing can be, and to thank everyone for doing their best. And I think Mono County is doing quite well. I mean, I think we noted over the weekend that Mono County might be the second best at social distancing after Napa County, and I said, come on, Mono, let's beat Napa. I did see some data today suggesting that our A rating has slipped to a B, so come on, Mono, let's keep it up. It is worth it. I mean, this is a crisis. You know, our hospitals could be completely overwhelmed. We could lose way too many people in our community. And California's modeling shows that if we can effectively maintain social distancing, we probably will be able to limit it to a point where the hospitals across the state can handle it. It's still going to be hard. There's still going to be a lot of really sick people. There's going to be deaths, but we can hopefully avert catastrophe, avert becoming another Italy or Iran or Wuhan city. So again, I'm happy to take questions later on.
Thank you, Dr. Boo. Our next panelist will be Dan Holler from Mammoth Lakes.
Thank you, Ryan. Dan Holler, the town manager for the town of Mammoth Lakes. Again, touching on a couple of key elements that the town has been working on. One of those is we've been partnering with through the county and with the Sierra Nevada Lodge to secure some emergency housing. People need that, who are at risk of homelessness or need emergency housing. That also works for emergency workers that we may need to provide some support for them. And also if we need people placed in isolation or quarantine and they do not have the capacity in their own homes to do that, we can provide support through that process as well. So we keep people as safe as possible and away from risk out in the community. If they end up on the street, we don't want them there. So how do we work through that? Some additional housing options are also being pursued through Mono County as well. So keep looking for that. If you're in that position and need that support, please reach out. Secondly, we've got, excuse me, kind of looking a little bit to the future. We have put in place protections for our commercial businesses in town where they can't be evicted. So a lot of them are closed, obviously, and employees laid off, and there will be challenges in their own rent payments ongoing. And so we are supporting them for they can't be evicted, and also doing some outreach and discussion with landlords even on participating in helping their businesses through this economic hard time. As we deal with the businesses and looking to the future on the recovery side, there are funds beginning to flow between the state and federal levels. We encourage businesses to see and get information on the SBA loans that are potentially converted into grants in the future. If you're not familiar with the Small Business Administration and their programs, I encourage you to reach out to the Mammoth Lakes Chamber of Commerce or the County Economic Development Department. They can provide assistance, help you understand the process to get through there. And the big thing, there's a lot of people getting in line. I believe they've talked to several people and businesses in Mono County, and getting in line, getting the paperwork in will be very critical. In talking with some of the federal agencies, they are going to be overwhelmed across the country. It's not just a localized issue for them. We've also been working with our partners at the United States Forest Service and looking at some of the changes they're making to reduce impact of people and the gathering together, and really, as was just stated by Dr. Boo, enhancing that level of social distancing. Some of that is a little frustrating for people at times as we're closing all the developed direct sites. So we don't want a lot of people up camping together. Often that is a very social environment if you're into camping. You get up there and it's friends and family and new friends you make at the campsite. So a lot of that is being reduced because of that type of interaction and people from out of the area coming in as well. So working with the Forest Service through that countywide, as well as Bureau of Land Management. And then we've had conversation with Mammoth Mountain Ski Area. They're ongoing with their food bank work. Also the Mammoth Mountain Community Foundation, who is supporting our children in education, and the families there with the schools are taking donations for that. They've also provided a volunteer coordinator to assist us with some boots on the ground work out in the community. And then we've also been working with them on ongoing maintenance and security issues at the mountain. A lot of people don't realize that part of our communication system is actually housed at Mammoth Mountain up on top, where we get good signals for 911, for example, emergency communication systems that we need to maintain and make sure that they're safe, as well as ongoing avalanche control and other safety issues on the mountain. So you'll see some work going on in that area. And then I think lastly really is looking out to the future as we begin to look at recovery issues. There's actually an economic branch of efforts under the EOC operations, and really starting to look down the road and says, what happens in 2, 3, 4, 5 months out? Where are we at economically, and how can we support people getting back to work? How do we support our local businesses, and how do we support our community through that time and into that point of recovery? With that, we'll pause and ready for questions here shortly.
Thank you, Dan. Our next panelist will be the Chief Medical Officer from Mammoth Hospital, Dr. Craig Barrows. Doctor?
Thanks, Brian. So my name is Craig Barrows. I'm the Chief Medical Officer at Mammoth Hospital. I'm going to start this like I've started most of my posts on our website, that I hope everyone is out there is healthy and is doing the best they can to get through this. I want everyone to remember that we are all in this together, and by working together, we're all going to get through this. I'm going to talk a little bit about our hospital capacity. Normally, Mammoth Hospital is a critical access hospital, which means that on a good day, we have 17 beds with capacity for 2 ICU patients. Based on anticipated surge estimates that I'll get to in a second, we have literally reconfigured our entire hospital to now be able to house upwards of 40 patients and potentially as many as 10 patients that need to be in the intensive care unit on mechanical ventilation. So that would be a breathing machine where you potentially need to have a breathing tube put in your airway, you're unconscious, and the machine is doing the work of breathing for you. Currently, we have 4 of those ventilators, and we're hoping to obtain 6 more, and we are working a couple of leads to get that. We're also working very hard to get oxygen concentrators, both for maximizing our ability to take care of patients in the hospital, as well as potentially have people be at home on oxygen if need be. This is the best plan we have. We've been working literally around the clock to try and come up with a plan to be able to take care of our entire community. Next, I want to talk about masks. As you can see, clearly everyone here is wearing a mask right now. As recently as this morning, our hospital incident command team recommended that all community members wear a mask in public. Why is this the case? When this very first started, the idea was a mask will not protect you from getting this virus. Like everything that's been going on with this, everything is rapidly changing. And we are now at the point where we feel like if I wear a mask and Brian wears a mask, I'm protecting him from what I have, and he's protecting me from what he has. And if we're all out in public doing that, we're going to do a much better job of preventing or hopefully slowing the spread of this virus. So good examples of that is if you're going out in public, like in this group setting right now, where we can't help but be next to each other and maybe not be 6 feet apart. Also, if you're going to go to the store, which everyone's going to have to do at some point, wear a mask. Everyone wears a mask and everyone protects everyone from everyone else. And then we collectively do the job of protecting our entire community. So that's where that has changed from the initial recommendation that it wasn't going to help to now we feel like that's going to help slow things down. When you have a mask on, please leave it on and try not to touch it with your hands. Don't adjust it. If you have to touch your mask for whatever reason, the next thing you should do is wash your hands. If you don't have hand sanitizer, soap and water works great. Lather your hands up and wash. Every time you touch your mask, you are potentially contaminating everything, including yourself. So be obsessed with the idea that you're going to wash your hands if you're going to touch your mask. And again, when you're out in public, and I'm talking about with people, that's when you're going to wear a mask. If you're at home, if you're walking your dog, if you're out by yourself and you got plenty of space around you, that is not where you need to wear a mask. But public venues where you're going to run into people and not be able to stay away from them and potentially risk either getting contaminated yourself or contaminating other people, that's where we're really encouraging you wear a mask. On our website, the Mammoth Hospital website, there are, I think now 3 posts of how to make masks. One of them is actually how to make a mask if you don't know how to sew. You literally don't have to touch a sewing machine or a needle or a thread. And the mask is pretty easy to make. Before this meeting, I tried it. I think it took me less than a minute to make it. So that's a really, really good option. Last, I want to talk about social distancing. And as Dr. Boo mentioned, this is hugely important. So to give everyone some ideas, if we estimate that our community and surrounding areas is 15,000 people, if we have poor effort with respect to our social distancing, so we don't really pay attention, I'm not going to wear a mask, I'm going to go do my own thing, we're going to go meet up and we're going to have a party at someone's house or a dinner party or whatever the venue may be, we're going to peak later this month with as many as 100 patients that need to be in the hospital, and of those, 20 are going to need to be on a ventilator. I'm going to remind everybody that right now we have a 17-bed facility and 4 ventilators. Math does not work. If we improve our social distancing, which I think we are at, frankly, to about a 50% effort, so we're doing about half as much as we can to really stay away from each other, not travel, stay 6 feet apart, don't put yourself in a situation where you're contaminating yourself and other people. That peak now moves out to June. And on our worst day, we have 25 patients in the hospital and 7 are on the ventilator or 7 are in the intensive care unit. Let me remind you, or let me encourage you to believe me that 7 patients in our hospital on a ventilator will be overwhelming. We can do it, but it will absolutely tax every last one of us to the most of our ability with respectability, the real capacity to be able to take care of anybody. Realistically now, if we have 25,000 people that we're dealing with, so now we're talking about Mono County and Inyo County, and people are traveling from Los Angeles and Orange County and San Diego, and they're coming up into our area. Even if we maintain that level of social distancing, we're now still looking at a peak in June, and frankly, the math just doubles. So now we probably have 13 or 14 patients on a ventilator and a total of 45 patients in our hospital. So we are now bursting at the seams. In consideration of that, we are strongly encouraging people to follow the governor's stay-at-home order and don't come to Mammoth. Don't go anywhere. Stay at home. Stay in your area. Stay out of areas that are going to be overwhelmed. You only have to look at other areas like Ketchum, Idaho, which got completely overrun in a matter of days because they did not practice social distancing in time. If we do what we're supposed to do, and if we stay in this for the long haul, our hospital, our community, we're going to be able to get through this and take care of everyone the way we want to and the way we need to. Thank you.
Thank you, Dr. Burrows. And I'd also like to thank you and all your colleagues for the incredible work and efforts you've put into this. So before we move on to question and answers, hopefully we have Robin Roberts on the line from Behavioral Health. I know she was having some technical difficulties. Robin, are you on the line? You'd have to unmute yourself.
Hi there, can you hear me?
Yes, absolutely.
Awesome. Thank you for having me today. So my name is Robin Roberts. I am the director of Mono County Behavioral Health, and I'm here to talk to you a little bit about what we offer, but also about how to stay well while you're doing what Dr. Burrows and everybody else is talking about, is staying in your residence and within the people, sequestered with the people that you already live with. So Mono County Behavioral Health is here for you. If you need support for any reason, you can call us at 760-924-1740. We have a warm line right now available in English and in Spanish from 7 a.m. to 7 p.m. 7 days a week. We are here to provide our regular services, but also support to our community, whether it has to do with just how to manage being in sequestration of some sort, or deal with the fact that you're schooling your kids right now, or that you might be alone. We're here for you. I want to really shout out to everybody who's behind the scenes on this. Your community, your hospital, your town, your county, your educational systems have been working incredibly hard every single day, multiple times a day, 7 days a week, to make sure that our community is safe and that the information that you're getting is clear and transparent. So I really want to make sure that people understand that. Also, that we have had a death in our community, and that creates grief for all of us. Again, we're here to talk about that on an individual basis, in a group setting if that's what you need. But more importantly, I just really want everybody to understand that this is not an easy time. The more that we are inside and away from others right now, the better. I know that people are getting fatigued for all of the ways in which we're trying to manage this, and that when we feel fatigue, we want to cheat a little bit on the sides. We want to kind of connect with other people, or pretend that right now it doesn't really matter if I see my family member, etc. And right now it really, really matters. So we're here to support you in your ability to stay at home, stay in your residence, whatever that might be, and answer any kinds of questions you might have that have to do with support. Thank you.
Thank you so much, Robin. And I'd like to thank all of the panelists that are here tonight. We are going to now move forward with the question and answer portion of the meeting.
First question, does the county and state order restricting the use of short-term rentals apply to private RV parks? If so, is short-term defined as less than 30-day stay, i.e. transient? Does this mean conversely that long-term or non-transient is allowable? The second part of the question is, will the county be suspending penalties and interest on late property tax payments?
Take the second half first. I think the way the property tax payment is working. The county has a lot of leeway in the waiver of penalties and interest. It's not automatic, but they do have authority to work through that. There's been questions regarding just the timing of the second property tax payment, primary in April 10th, I think. I haven't heard if that's been shifted yet or not, but that discussion was happening at the state. They control property taxes, but there is some leeway in the waiving of penalty and interest at the county level, and that's across the state. The RV park question is one that actually we're spending some time researching on it because of the private parks. That question comes in, and it's that right now transient rental is 30 days or less. The long-term private parks you can rent for 30, 60, 90, 120 days is being looked at. Two concerns. One is if you are there and we allow that over the 30 days, that's fine. But again, you still have to obey all the other rules. That is now your home where you're supposed to stay. You're not, spending time with your neighbors, the social distancing. All of the same elements would apply there as if you were in a home or apartment anywhere else, doing those types of elements. The other thing that we get pushed on that is people, frankly, fudging, and they'll come in and say, yes, I want to rent a place for 31 days or 40 days, and then they pay, and then 25 days, 20 days, 10 days later they leave and they go to the next place and make the same request. And so it's a management issue in that perspective. And so we're asking people not to go around the rules, but we are at the command level taking a hard look at that beyond 30-day in a private RV park. And this would not apply to campgrounds in the Forest Service, et cetera, as those are restricted in the same way as other transient rental properties would be. So difficult question, but if that is allowed and people can do that, all the same rules still apply. If that is now your home, stay there, stay in it, and enjoy your RV up close and personally.
So Dan Holler provided it was a very solid administrative answer, and it's all correct. Want to put a little bit different part to that answer, and that is if you're coming here from someplace else, regardless of the reason, you're simply adding to the number of people that we've got to protect here. You bring in an additional source either from yourself or we could expose you too. This is not a good place to be right now. We are trying hard to take care of the community, and as we add more people, regardless of what the rules are, in case anybody didn't hear Dr. Burrows, we're not in good shape here to take care of it. So this isn't a time to be looking at gray areas in the rules. This is a time to take it very seriously. Wherever you're at, stay there.
Short-term renting is going on in Mammoth Lakes. What do we do?
First and foremost, if you believe that is happening, you're seeing it is reported. We have so I don't have the phone number in front of me. We have a hotline you can call. You can do a website. If you look at the town website, you can find information there. We do actually take that very seriously. We've had several conversations with people that we are pushing on. There are some allowances for short-term rental, very, very narrowly focused based on the governor's executive order for staying at home in the towns. Our goal would be the same thing as you just heard from the fire chief, is that this is not a good place to be and be critically ill, as noted. We don't have that capacity there. So a lot of people looking at, hey, I'll get away and go up into the mountains. I'll go to Mammoth or in the Mono County area, get out of wherever I'm at. That's probably not the safest move you can make. You're better off to stay at home. It's much safer from that perspective, and we would encourage you to do that. But if you know people or you believe they are, not everybody who appears to be short renting actually are. If you own a place, you can come up, you can be in your home here still, but report it. We get that information here soon. I'll put it out to you for the phone number to call our hotline.
Next question is from Don Lazar. Thank you for doing these meetings and informing our community. My question is about transparency and communication. It would be nice to have updates on how many people are really sick at home and not just test result figures and with what types of symptoms the doctors are hearing about most. How this is really impacting the health of our community that is not the hospital or being flown out of here. Let community know that everyday people are getting mildly, moderately, and scary sick in Mammoth Lakes.
That's a really tough question to answer. And the reason is we simply are not able to test everyone like we would want to. And frankly, we're telling a lot of people that are symptomatic with new onset fever or cough in the last couple of weeks. Those are the most classic symptoms, that they probably have this because we know it's so contagious. We just don't have the numbers of how many people there are. I can tell you that we've tested, I think, somewhere around 85 people right now, and we have either 18 or 20 positive tests. Of those, we have had to hospitalize 5 of them. I think it's fair to say that there are many more people than we are testing that have this condition. And we have been preaching the idea that you have got to assume that people have this all over the place. And that's the reason we're wearing masks. That's the reason we're doing social distancing. That's the reason we're taking all of these precautions to try to make certain we're not spreading it as like a wildfire, which is what will happen and what we've seen in other communities.
Thank you. Excellent answer, Dr. Burrows. Tom Boo here. I just want to add that I am very interested in that issue, that question myself, and we are on the verge of offering a nurse advice and triage phone line. It actually was piloted today, and we're going to be encouraging people who are sick and think they might have coronavirus, COVID-19, to call that number, and we will be able to keep track over time of what, we hope, of whether there's increasing, decreasing amounts of disease activity in the community through the phone line, and we will try to combine that with some strategic testing to confirm that we are dealing with COVID-19. We will not be able to do widespread testing in the immediate future. We just it's just not available. But we certainly hope to be doing that in the future. So for right now, it'll be a combination of going by frequency of symptoms and strategic testing.
I just want to add one other thing. The answers we're giving you right now are literally the answers today. Please keep in mind that this is changing faster than we can keep track of. And it's very possible that with all of the biotech companies out there and all the different tests that are coming out and different strategies of how we look into who's positive, who's negative, who's been exposed and whatnot, the answer you're hearing right now could be completely different by literally next week.
And I just want to clarify the numbers. We've had 18 positive cases that were tested at Mammoth Hospital and 1 other case that was tested at another hospital for a total of 19.
And just to echo Dr. Burrows' statement that by no means reflects the amount of disease in the community. We know there's a lot more out there. Be careful.
The question on the TOT question in Mammoth Lakes, if you do believe somebody is, the hotline number is 760-965-3670, or you can email tot@townofmammoth.ca.gov.
Is there an ordinance to make second homeowners go back home if they showed up after Sheriff Braun told everyone not to come up? Should residents report second homeowner neighbors that have shown up after the notice to stay home?
No, there is no legal authority if you own a home, and that's a residence that you can live in legally. We cannot forcibly ask them to leave. And again, if you're in somewhere else and you're looking at this in that second home and you're coming up, again, the same rules apply. Come to Mammoth, come by yourself, stay by yourself, wear a mask, stay away from people. And frankly, even I would say limit how much you're exercising outside and stuff as you're passing people in the trails and other activities going on that way. And again, the reminder, we have a limited capacity for medical services. Again, this is not a great place to be for critical illnesses. And to either bring or come up and get ill, is just not a good idea, but it is not illegal to do so.
Let me just add for people that are coming to the area, we're at 8,000 feet. 8,000 feet is a lot tougher than sea level, especially with respiratory illnesses. A lot of things you can get away with at sea level, you can't get away with here. And we see that routinely with people that get sick here. They have a harder time. So as everyone is saying, if you don't live here, that's just another reason not to come here, because the altitude makes it much tougher and you will be sicker.
And if I can even jump in again, I think most residents know that Mammoth Hospital and Northern Indian Hospital and Bishop do not do a great deal of critical care. We have great doctors and nurses, respiratory therapists, and they can take care of very sick people, but people who are really ill are frequently much better off in large medical centers, large urban medical centers, and we're very afraid that our ability to transfer people like we always do, that's what happens here. You get critically ill and you usually get transferred to Reno or Southern California. That as the hospitals in those places fill up with COVID-19, we're not going to be able to get you out of here.
Where can you purchase a mask for going out in public?
Probably right now, the best option, and it's not the only option, is, as I said, is to make a mask. On our website and all over the internet are how-to videos on how to make your own mask. And I'm going to say that the advantage of that versus buying a mask is this. A regular surgery mask that we use in the hospital, you've got to get rid of at the end of the day, and you're going to burn through that supply. If you make a mask, you can, out of material like I'm wearing right now, at the end of the day or when you don't need it anymore, you can put it in a plastic bag like this so it doesn't get contaminated where you're not contaminating surfaces and it's not getting contaminated. And then you can put it in the wash and it's ready for the next day. So you have a resource that you can use over and over again.
And there are some great, grassroots community mask making efforts out there. It looks to me like me and Dr. Burrows are wearing masks made by the same person. I don't know who made these masks, but there are people in Mono County and in Inyo County who are working together and sharing designs and actively making masks. And I think that's just outstanding, and want to give kudos to those people and encourage more people to get involved in making masks for those of us who aren't very handy.
You keep talking about, quote, the rules. Who is enforcing these rules?
So again, a lot of the rules that we talk about here is we have the state order in place, and that tells people to stay at home. That is not being enforced heavily. From the governor's comments and others, it was not designed to become a police state, if I can use that term loosely, of having officers out and questioning people and doing that nature of enforcement at that level. And so while we want people to stay at home and that order's in place, it is primarily really a voluntary order. Please do that. Again, the sense of the pandemic that is upon us, you would think that would be enough, that you actually could end up sick and seriously ill or dead. So really think through that whole issue on that. As far as enforcing the rules related to, again, short-term rentals and those types of elements, gave out that phone number and email address, and then that is a town responsibility within the town of Mammoth Lakes. That would go through a different process with Mono County.
Is there any way that the daily updates can include information about location/residence area of newly confirmed cases? Are we to assume all of these new cases are based in Mammoth? Mono County is a large county, so curious how widespread across the county this is, or if it's purely centered here in Mammoth.
So we're not willing to actually give out that information. Just assume that it's widespread throughout the county, and that is your best way to stay safe. Act accordingly.
At this point, as Dr. Burrows said, assume it's everywhere. There was a period not too long ago where we were in denial here in Mammoth too. It was in other places. We hadn't tested, we didn't have any numbers yet, and people were flirting with the idea that somehow we would miss it. We're not missing it. It's here, it's in Mono County. Don't try to outsmart the virus that hasn't worked anywhere on the planet.
Yeah, and remember, Bishop now has about 10 cases. It's in the Eastern Sierra.
I would even clarify, Bishop has 10 confirmed cases, and I'm sure they have way more than that.
I have noticed that second homeowners returning to their residence up here, can we require them to have some sort of quarantine or test for coronavirus?
No. At this point, we don't have a quarantining order in place for local government or the state from that perspective of people coming in. And then to require that there, you think if, would that apply to somebody coming from Benton or Crowley or coming up even from Bishop and stuff? And so if people had a home close to here, where would you draw that line and those types of elements? We understand the concerns over the second homeowners and others coming up. But please, we remember they have that right to come up. We're not inviting them, we're not encouraging them, but they do have that right and that freedom to do so.
And Tom Boo again, and I would just echo that we want people to stay home, not travel, not interact with other people, and it's probably folly to focus too much on outsiders. We do want less travel and less visitors, but it's here. We probably have as much coronavirus, COVID-19 disease here in our community as they do in other parts of California.
I am concerned that Mule Days is planned to go forward in Bishop, which can potentially invite hundreds of people to the area. Are you involved in conversations to put a stop to this planned event?
Haven't been. If I was the Inyo County Health Officer, it wouldn't happen, but we will engage.
Are we providing masks and gloves for our grocery workers and others that deal with the daily public?
Well, I don't know if it's happened yet, but I did get some homemade masks like these from one of my neighbors who's a retired nurse, and I think she gave me over 100, and I gave them to one of my colleagues at the health department who handles all the personal protective equipment, and I asked her to distribute them to people in essential sectors, and that would include public employees, but we specifically are also want to make sure that people in healthcare and grocery stores and pharmacies and things like that have access to masks. There's a problem of supply. I don't know if we have enough to go around, but again, hoping that the grassroots production operations will rise up and gradually help us meet the need.
I'm sure a lot of people in our community are aware of the fact that we have a food bank that is feeding an enormous amount of people every week. Today, the hospital incident command team actually approved and distributed over 20 homemade masks for the food bank volunteers to wear for the very reason of trying to prevent spreading this to themselves and the people they're trying to help.
The availability of masks from a logistical standpoint has been very, very tight until actually fairly recently. So as few as 2 days ago, we were able to secure some additional resources, and yet those will change on a day-by-day basis. So our first responsibility was to get the protective equipment to the people who are doing our patient care and doing our first response out in the field. Once we've got as I said, one of my primary responsibilities is getting this logistical buildup. Now that we're getting caught up on some of that, then it makes sense for us to find ways to distribute these a little more widespread in the community.
Do scarves or other things like that work?
We're recommending any cloth covering for the mouth. Bandanas might be a little on the thin side, but scarves are probably pretty reasonable.
And one of the things we've talked about with making masks is the idea that you're folding the material over, so you're doubling or potentially tripling how many layers the particles have to get through.
How does Mammoth Hospital decide whether to send to Reno a patient who is presenting with severe symptoms or to use the local hospital's ventilators or ICU care? Might Reno start refusing patients from here?
We start out with the idea that we're going to take care of anyone that comes in the door that needs to be taken care of. Again, we are a critical access hospital. We do not have the resources typically to take care of a critically ill patient for a long period of time. And that probably more than anything else is the reason that we wind up transferring them. I personally am a board certified critical care doctor. And while I'm comfortable taking care of that patient, we just don't have the staff that you have to be able to take care of someone like that. There's just way too much demand time-wise and resource-wise that we don't have. Let me emphasize, it is not because the people there don't know how to do it. It's just not having enough resources to do so. When that happens, never mind the COVID situation that we're currently in, we typically transfer people out because places like Renown Medical Center do have a fully staffed intensive care unit with all the resources and different specialists and different modalities that are going to be required to take care of someone like this. We fully understand, recognize, and are preparing for the fact that the ability to transfer people out is probably going to come to an end as soon as everyone gets overwhelmed. So Renown Medical Center, while a wonderful resource, if they're full, if Carson Tahoe Hospital is full, if USC is full, if every other hospital in Southern California is full, we're going to be stuck taking care of people, not because we can't ordinarily take care of them. We're going to absolutely do everything in our power to take care of everybody. It's always our preference to get people to the best possible location where we can allocate the best resources and help for the best outcome. If the best outcome is going to be taken care of at Mammoth Hospital because there is no other place for them to go, that is absolutely what we're going to do. So it is not typically a coin flip of who we send out and who we keep. It's always in the best interest of the patient as to where they should be for the type of care that they need.
Is testing capacity and speed getting better? What's the time frame for that?
Testing capacity remains to be a problem. The turnaround time, however, has improved greatly. We're getting results back within 24, 48, 72 hours at this point.
I know it's a bit early, but has the town started thinking about when the stay-at-home order is lifted and how to keep Mammoth from becoming the state's first vacation site? Are we worried about becoming inundated with visitors before A, we're sure that it's okay to be in crowds again, and B, the businesses are ready to back up to full speed?
Dan, do you want to take it or should I? Yeah, I instituted some restrictions, but then the governor, the statewide stay-at-home order was broader and stricter than we had done at that time. So obviously, the statewide order is in place and will be in place for a while, and we will be working with the state to decide locally when the stay-at-home order is lifted. We're not going to just go back to business as usual. There's going to be ongoing restrictions for some period of time. And when we're in the incident command and the emergency operation center, we're just starting to discuss, what that looks like. I mean, how can we continue to protect the community as best we can, but also mitigate, some of the economic harms. But it's going to be a while. I mean, I think the state is definitely, looking at probably. I don't have inside information. I have not heard any estimates or predictions. But when I hear them talk about modeling and how long we have to do it to keep the hospital to help the hospitals in California survive, I heard today they were talking about like mid-May. So that might be kind of the horizon we're looking at.
After this question, we'll go into call-in questions. If I call your name, please unmute yourself. What are you doing to keep these open restaurants in compliance with COVID-19 safety rules and procedures? I have heard that certain fast food restaurants are not in compliance.
There's the primary issue on that is we have been working with Mono County Health Department. They have, I think, one full-time position, so getting out and doing stuff is difficult and time-consuming. We have looked at options as if people are out from the command staff or others, that we can raise up those questions. The challenge in any of that is because it is takeout only or to go, often you're not in the restaurant or you're not going inside to look and check on things. But the goal is there, hopefully, that the people working, and this goes for any place where people are working, is that they're doing their best to, one, keep their nose and mouth covered, that they are looking at social distancing, even at work to the extent possible, they're keeping away from each other, and that they are continually washing their hands. And if they do have to cough or sneeze or something, they're doing that into their arm or their elbow. To really push those types of standards. We've actually given information out to every business that's open a couple weeks ago, and really trying to push those factors. But the enforcement is probably, it's limited just from a flat out capacity, capability and number of people available to actually go in and do the walkthroughs.
However, we do have an environmental health department in the health department, and they are responsible for restaurant inspection and know all the restaurant operators very well, and the director of environmental health, Louis Molina, has been making the rounds and visiting the restaurants and educating them, and I have a lot of confidence in Louis's expertise and rapport with businesses, and I think he'll help keep us safe.
And also public health has been going around to the businesses and providing them with hand sanitizer that's been provided to us by Devil's Creek Distillery.
First phone question is from Summer. Go ahead, Summer. Unmute her.
Hi, Summer. You have to unmute yourself, please.
Keep going. Yep. All right, next question is from AGTK. Go ahead. What do you want me to do?
Are you there?
Maybe explain to people how to unmute.
Oops. Yeah, can you hear me?
Yes, we hear you.
Okay. This is a several-part question. The first is that about testing for infection, and there have been announced a number of tests that can provide availability within 5 to as long as 45 minutes. But the question then comes up: what's the availability of this testing for folks in the country? And so my first question of a couple is about whether or not you are going to have access to that, and if so, when? Are you in the queue? When do you expect that you could have that? Because that's obviously the kind of thing that can facilitate drive-through testing.
Did you want to give you the second part of your question first, or?
Oh, yes. The second part of the question is about the test of antibody immunity tests, which are also becoming available. And part of the reason that I think part of the reason that I think that those are important is that if folks have been infected and developed antibodies and are no longer infective, then those people can be freed up to do a number of things that those who are still at risk can't.
Thank you for your question. So a lot of the tests that are currently coming on market are not FDA approved yet. Some of them are being fast-tracked. We're looking at a variety of different tests, including the Abbott test, which is actually FDA approved. We're hoping to get on the list to get that in our county.
Yeah, that's the 5-minute test that I was alluding to that is FDA approved.
Correct, and that is actually being controlled by the federal government, so they'll actually decide who actually gets the devices to run the test and the test themselves.
Okay,
And
so
Tom,
you have no idea when you're going to get access to that. That's at federal distribution.
That, for the Abbott test, correct.
we're looking into it, we're pursuing it, but we don't know. As far as the antibody test, I'm not sure if that was really a question you asked or a statement, but I agree with the statement. The antibody tests have value, and I think for disease control and just kind of understanding this epidemic in our community, you need both, ideally. And we have actually ordered a modest number of antibody, rapid, point of care antibody tests, but we honestly don't know if they're any good. We didn't order very many. And then if they are good, we don't know if we'll be able to get more. So it's kind of a challenge.
Yeah, we're actually actively looking into the antibody testing as well, both acquiring it with respect to how many people we can test. And then quite honestly, we have to come up with what's the best protocol for who to test and what are we looking for. All of that has to be surrounded with a strategy of how we're going to best use that information to either contain this disease or, again, slow the spread. And that's a really complicated question to answer. And we don't have anything firm yet as far as how we would roll that out. But I can assure you it is a hot topic of conversation almost every single day.
Next question is from Keith. Go ahead, Keith.
Hi, thanks for taking my question. And I want to thank you guys for keeping us informed. This is really helpful. I drive for ESTA, and I've been driving every day until today. I decided to stay home because I'm 67, I'm high risk, and so they offered us a little package to stay home and do our part doing that. My question is, I live down in Sunny Slopes, and I like to take my dogs for a lot of walks because I have the time. And the campgrounds have signage that was put up a couple of days ago that says facilities are closed up to a $5,000 fine. Can I walk my dogs in there? I'm not using the facilities. I'm not camping. I'm not with anybody. Do you know the answer to that?
Yes, I mean, I can, yes, I mean, I don't think you're forbidden. I don't think anybody's going to enforce it if it is against the law, but yes, I'm sure you can. It's really about the Forest Service closed all their developed sites. I don't know if that's what you're talking about, but I don't think they've, put up no trespassing. I think you're welcome to walk your dog there.
Next question is from vilijavk@gmail.com. Go ahead.
Hello? Hello?
We hear you.
Hi. My concern, and I've already expressed it to the hotline, but I'm concerned enough to express it again. Everybody keeps talking about the second homeowners. I'm concerned about the SCE workers that are here in town doing non-essential work. They are doing tree trimming because I have been told that they're not going to have time to do that in the summer. And, I have been told that this, Southern California Edison, it's an essential service and needs to be here. Okay, they need to be checking the power lines. We don't need to have these crews here trimming trees. I reported it that as of 2 days ago, there were 5 workers in a single truck. Well, whatever, they were taking their lunch break sleeping, but I would like to know specifically, where do they stay? Do they have separate rooms? And as of last summer, they all went back to Los Angeles on the weekends. Are they going back on the weekends, or do they have to stay here?
Hello, this is Chief Freevault. I think we probably actually spoke on this, and since we got off the phone, I forwarded a letter to Cal OES requesting a determination on the essential nature of what they're doing. They are, by the governor's declaration, recognized as an essential service, utilities are, but not everything they do is essential. And so we specifically asked that question, if we could defer that until we get on the other side of this crisis. I know that's been bumped up 2 levels in Cal OES. I also phoned the regional supervisor for this area with the accurate and justified concern that you had. So we are presently seeking a supportive letter from Cal OES to, there was additional work that they were looking to bring in. We're looking to stop that. And we're also looking to defer all the activity in the area.
That's all for the phone-in questions. Back to the online questions. Why are the bus/trolleys still running?
The ESTA service in town is still running for 2 different reasons. One, again, under the governor's order, there's a whole discussion about the value in maintaining a public transit. And so one, it is allowed as a kind of an essential service. The other side of that is we still have people that need to move around in Mammoth, whether they're going shopping or whether they're going to the pharmacy. They have jobs still. Some of them are still working in different places, and they do need that transportation. So there is a public service still to be provided. We are actually reviewing that and looking at schedules. Will we continue to do that and look at, do we reduce that down? We've tried some work where, people getting on the bus sit apart from each other, that social distancing. It's not heavily utilized, at least anecdotally. We just changed the routes starting yesterday, I believe, April 1st. We will see what that usage is and if we need to reduce it down further, and or if we really look at it as a potential area of contagion, then we would move forward to discontinue the service.
Do you have any clear data on how long someone is contagious after testing positive or onset of symptoms?
I don't know if anyone has clear data on it. What is pretty agreed upon, I think universally, is the idea that the onset of symptoms typically can start as soon as 2 days after you've been exposed. And probably by 14 days, you are no longer shedding virus. Now, a lot of that is assumption, but that seems to be the general trend. For the most part, once you don't have fever for 3 days, you haven't coughed for 3 days, you're probably not shedding virus. So that 3-day window plus a total of 14 days from the onset of symptoms is what we're typically looking at with respect to where are you still at risk of spreading this or infecting other people.
Next question. We have a house that is not being used. Is there any way we can be of help?
Potentially, I would say if you reach out to the EOC, they can take your information down. If we would need a place for some type of emergency workers, or if they're allowing it, if we had a family that needed to be quarantined away from other family members, if that type of use would be acceptable. There's those types of issues that do come up at times in terms of how do we help support that part of the community. Again, the other side would be we do have other people who are challenged in housing, if you will, in terms of having adequate housing, and that would be another option. They could always put it on the market as well for a long-term rental component. People are still looking for housing within the area, and that may be an option as well on a long-term basis.
We have 2 pending tests according to the website as of today. Does that mean the hospital is no longer testing, or are people no longer coming in with symptoms?
That does not mean that we are not testing any longer. I'm not exactly sure the first part of that question. We have pending tests. Is that what the question was? Yeah, 2 pending. 2 pending tests means we just don't have the result back yet. We are still very much testing.
And those pending numbers that you see are actually from yesterday. They don't include any testing that happened today.
Is there anything that the town or MLT can do to put forth a more aggressive message to out-of-towners to not come here?
Well, we have a couple of different things. One is we are messaging out to people about not coming here. Somebody earlier in the conversation noted the comments by the sheriff and the LA Times. There's been other outbound messaging saying not to come to Mammoth. The lodging companies more and more are taking down some of their ads. That's a whole nother issue. Airbnb has actually put out a statement letting people know that they're not to be advertising during this time. So I think that message is getting out there. The other request that has come forward is some type of, initially it was just like a blockade, if you will, maybe not that strong on Highway 203. We've actually kind of moved that up the chain with Caltrans, who would have authority to approve something of that nature, but more as a checkpoint as people come into town. Maybe, could we have a conversation with them? Hey, welcome to Mammoth. Glad you're here. What are you up to? Where are you going? Where, getting to work, whatever those questions might be. And then that would be one of those issues to say, hey, if you're just up here visiting, you're probably in violation of the governor's order. We really are not encouraging or allowing people to rent short-term unless you have a certain category. Are you sick? Are you ill? Need housing from that perspective. And invite them to get their gas, buy their grocery, and head home. So those types of things we can do. So those types of elements is a push out there, and we are pushing that out again to our lodging community as well. Thank you. We have a lot more questions left. We're running toward the end of our time. I guess I would point to the panel if you want to continue to ask, answer a few more, and maybe give another 5 or 10 minutes, and then we'll end up wrapping up this week's community conversation.
Is Mammoth Mountain Ski Area doing anything to support the community? I see smaller businesses like Footloose, Liberty Bar, Blue, Mammoth Lakes Tourism, etc. helping. I'd like to know if Mammoth Mountain is providing any support.
Yes, to my knowledge, they do have a food bank program that their employees are supported from, the housing component there and others. The other side, substantially from Mammoth Mountain, well, their first biggest support was actually closing the mountain, just reducing the number of people that would have been here as this virus was moving into the community quite strongly. On top of that, the Mammoth Mountain Community Foundation has been very supportive, working with fundraising and support for our schools and the families and the kids there. And they have also donated to us, if you will, one of their ski patrol leaders, if you will, to help us with some of our programming and work. And I believe they're covering the cost of that person to be engaged through the Emergency Operations Center.
Is there a way that Mammoth can do a PSA to second homeowners to not come back and forth to the area if they haven't been here already for 3+ weeks?
We've been messaging out as they do that. They are actually, I would say they're probably in violation of the governor's order in that they should be at their residence. Pick which one you want to be at and stay there. That has been an ongoing message, not to be traveling between point A and point B. And maybe they have more than 2 homes even. Some people have multiple. And the idea would be return to your residence of choice in that case and stay there. And put that information out. We've had a lot of that going forward. So,
is it possible to add the number of people recovered and the number of people hospitalized?
I'm sorry, is it?
Sorry, to the coronavirus website.
The number of people recovered.
And the number of people hospitalized.
Well, we don't truly know how many are recovered. We can guess, but that's just what that is a guess, as opposed to those other numbers, which are more hard and fast numbers. We know the number of people that we've tested. We know the number of people that have tested positive. We know the number of people that have been hospitalized. I don't know if it's fair to put a guess out as to how many are now recovered. Again, I'm going to emphasize everything changes very quickly. And if and when we do get, I'm going to say probably when and if, as opposed to if and when we get to antibody testing, we're probably going to be in a much better position to identify how many people are now recovered. That is not unprecedented. Germany as a nation is already working with that type of strategy where they have effectively created an antibody passport that signifies that you are now felt to have some immunity against this virus and you are not contaminating or spreading it to other people. We certainly in Mono County are not anywhere close to that. I don't think even in this country we are yet.
And if I could add to that, and maybe ask Dr. Boo to weigh in on this too. There's a lot of discussion about testing, and that's good data, but it doesn't do really anything in combating the disease that we're faced with. Again, you go back to if you test negative today, depending who you talk to on the street tomorrow, you may be positive. And so I think while the testing is great and we're looking at it and how do we enhance it and how do we get that information and data, we'll go back to the core message that we've been trying to put out of the social distancing, the physical staying away from other people, the washing your hands, try not to touch your face, the washing your hands, the coughing into a tissue or a hanky or into your arm. The basic things, the single best element for protecting yourself from COVID-19 is to stay at home. And how do we drive that message over and over again? All the other data is great in doing that, but getting tested, if you're negative today, you may be positive tomorrow. If you're positive and you know that and you go home and tell everybody, you may have just infected your whole family. So there are just a number of challenges as we see with that in the testing. Again, do we want to see more? Yes. Does it actually stop the spread of the disease? No, it doesn't. It gives us data and information, individual data, but really stay home, stay away from people, stay clean, really protect yourself to every extent possible. And I don't know if the medical profession can weigh in on that. I'm not a doctor, nor do I play one.
Statement. So we have time for one more question.
I heard the first part of the meeting indicating a reasoning as to why Spanish interpretive services were not offered at this meeting. When will the command center have something for anyone who speaks Spanish? Will the Spanish-speaking community be in the dark until next week, or will there be interpretive services not be offered from here on out?
Thank you. Cassandra is going to take that question.
Hi, yes. I am the Hispanic community leader for this outreach. And so we are working on a team that's going to hit home for the Latinos in our community. So what I mean by hit home is I want to give a clear message that is understood in the, in the language that they talk within one another at home. So bear with us. I just want to make sure that there's no language barriers in this and that there's no confusion as well. Thank you.
And speaking for us, I mean, if there's another forum like this targeted to Spanish speakers, we'll show up. We'll be here.
Sandra, could you repeat that in Spanish?
Yeah. Oh, claro. La pregunta era si va a haber alguien que va a traducir esta junta. Ahorita como mencioné cuando empezamos la junta es que estoy trabajando en un equipo para poder mandarles el mensaje claro donde no haya ninguna confusión para todos.
Thank you, Cassandra, and thank you to all the panelists. Please join us next week for the most recent updates. Until then, take care of yourselves and each other.